But the clinic's a very professional operation. From the minute you walk in the front door, the nursing staff are fully uniformed, the reception staff make you feel very comfortable and at ease. The facilities and the ambience of the centre is just magnificent. And the fact that Dr. Dattoli is there for you. I mean, he is a brilliant, brilliant man. And there's no doubt about it. He's probably given me another 10 to 15 years of life expectancy over and above which I would have got in England.
The seething process yesterday, it was no problem whatsoever. I really didn't realize I was having anything done until it was over with and they said, "You're through." I rested overnight and I was released this morning and feel great. We're from Montgomery, Alabama, and we're going to try to drive home today, so we feel good.
I was looking for the place that did the most seed implants or brachytherapy and radiation. And when I called the Prostate Resource Network, she helped me sort through that I should actually be looking for the doctor and not so much the place.
It was very easy for me to see that for me to find the best doctor that had a volume of procedures under his belt and survivors that spoke well of him and a manner that made me feel confident that he was the right man for the job. I did a little bit more research because I'm very thorough and decided that Dattoli Cancer Center was the place for my personal survival. And when you're fighting for your life, you spend 3 or 4 months and you do whatever you can do, and you visit as many great institutions as you can, and you do the pros and cons and comparatives to make that decision.
Most of my time has been spent with Dr. Surace, and in fact I was quite impressed that this clinic called me back without any expectation of me ever attending here, and Dr. Surace spent an hour and a half with me on basically any and all questions that I had. He had a copy of my pathology report, and on that basis was willing to spend, as I say, an hour and a half going through state-of-the-art as he knew it, and that impressed me.
And then with all the information I've gotten about the center, and the option that I had as opposed to surgery, I knew the results of the surgery and its percentage of completeness of success or you know, curability wasn't that, I mean, it was high, but there was a price to pay for that. And as I said before, you know, I'm very active indoors and outdoors. I'm 61 years old and happily married. And I wanted to know if there were alternatives. And with Dr. Dattoli's center, and as highly it was recommended to me, I came and I investigated. From the time I walked into the door, I felt at ease. They were very sensitive people.
The treatment itself was quite amazing. There was no pain during the radiation. There was certainly no pain during the implantation of the seeds, and that was the bit I was probably most nervous about. And yes, I literally got in my car and drove back to the cancer centre here about 12 hours after I'd had my implant, which was just phenomenal. I couldn't believe it. And I got the plane back to England the next day.
This clinic, the Dattoli clinic, 10 out of 10 for technology and processes and equipment, and certainly a 10 out of 10 for people. So I had absolutely no concerns about coming here.
From the minute you walk into the centre, you're surrounded. There's an ambience of professionalism. There's a feeling of comfort. There's a feeling. There's an empathy. They fully appreciate the mood of the people who are coming in that front door and what they're going through, and there's no substitute for that. It's not a cold, calculating, business type environment. It's we're going to get you well, guys, and this is the place to get well. So come on in, and the sooner we get started on you, the sooner you're going to walk out completely top and tailed, as they say.
Because you're fighting for your life. And when you've got a wife and children, and you've got, I'm a rather young man at 55, I expect to be around when I'm in my 80s and 90s. And this is a disease that can kill you, and if you don't have the right care or the right treatment, you can shorten your life.
With a combination of the treatment at the Dattoli Centre and the seeding, you have far less side effects longer term. you remain, or you don't suffer from impotence, you don't suffer from incontinence, and you certainly don't have sort of a 5 to 6 week period of rehabilitation once you leave hospital. I mean, I actually got on a plane the day after I had my seeding. I went back to England and started leading a normal life.
And the whole issue, the whole challenge of cancer, not just prostate cancer, is one of statistics. So you've got to do your homework, you've got to talk to all the people that you can, and at the end of the day come away with what makes you feel comfortable. And as soon as you're ready, get at it. But you've got to be comfortable with the treatment plan that you've chosen. And don't assume that your primary health giver, the doctor that you spend all your time with, has all the options in his head. These things are changing, and they're changing rapidly. You've got to do your own homework.
But when I spoke to Dr. Dattoli, I got a great deal of comfort that there was an option for me. And I'll never forget his last words. He spoke to me, I think it was just after Christmas actually, before New Year. And I'd sent him through all my files with all my records, my charts, my x-rays on them. And when he rang me back that night at 2 o'clock in the morning, he said, I would be very happy to treat you with intent to cure. And then my clouds went away and I was walking 10 feet tall again. I got my self-esteem back and I just felt great, absolutely great. And you know, God willing, that's what he's done for me.
I bumped into him briefly in the lobby downstairs. I'm a golfer, and I thought, hey, maybe I'll ask the doc to come out and play golf with me. And I said to him, what do you do in your spare time? And he said to me, I don't have any spare time. This is my life. And I was kind of happy to hear that. I'd rather have him answer me that way than say, sure, let's play over the next 2-3 weekends. It was kind of reassuring to hear that.